Oh, thank you very much. How are you today?
Yeah.
Good, good.
Councillor
The weather
Bamforth,
could be
you
better.
are not muted any longer. He is now. Okay, very good. That could have been, especially with recording these now, that could have been very, very dangerous. Right, okay, so welcome everybody to a special ECM meeting because we have an item to deal with to award a contract, which we have to do in a certain amount of time. So that's why we're here when we otherwise wouldn't have been. Yeah. I know that particularly elected members have got plenty of other things that they would like to be doing as well at the moment. But so I am grateful that everybody's come together and opposition members are here to listen and scrutinise. Firstly, Susan, we don't have an agenda where we say apologies for absence, but has anybody told us they're not coming that we would normally expect to come?
Yeah, Councillor Price has said that he can't make this meeting, but that's the only one that I've received. Yeah.
All right, so thank you very much. So no Councillor Price, but we have got the other opposition members on. So we can move into the only item on the agenda, which is the contract for the Children and Young People's 0-19 service. And Suzanne, are you going to take us through this report?
I am, yes, thank you, Chair. So just in summary, to start off, this report seeking approval to make a direct contracts award to Bolton NHS Foundation Trust as incumbent provider for the future provision of children and people's 0-19 services using the new provider selection regime. And we're looking for that service to be in place from April 1st of April 2025. So new service in place from next year. So just very quickly, you've all had sight of the report. Page 3 outlines some background information and summary around the contract as is. So the council has commissioned the Foundation Trust since April 2019 to provide a 0-19 service. Essentially, 0-19 service is a health and wellbeing services for children and people from birth up to the age of 19 years and 25 for children living with special educational needs or disabilities. As I say, the council's commissioned this service since April 2019 on a 3+1+1 contract. It has been extended for a further year, which takes us up to the 31st of March 2025 when that contract expires. So it's really essential we have that new service and contract in place from April 25 onwards. The report goes on to talk about new procurement legislation and rules that were introduced in January this year, known as the provider selection regime. This has been considered, this new legislation has been considered by our legal and commissioning and procurement colleagues with a view to look at commission intentions for this service. So following that review, we're seeking approval to secure a new 0-19 service from next year using provider selection regime direct award process C. In terms of service as is, just to give you a little bit of context and further information, the current service provides a range of universal health check, developmental review, screening, immunisation. So that's for all children and young people across the borough, but it's really key that those are important checkpoints so that targeted and special interventions are in place for when additional needs are identified. So the service includes specialist public health nursing, so that's health visiting and school nursing services. It also includes a health and families service, which is intervention programmes around things like speech and language support, infant feeding, healthy weight, and a strong parenting offer. We also have an adolescent service in place, which gives local young people food parallel service, support around substance misuse and sexual health. It's really important to note that some aspects of the service provision and delivery are mandated, which means that obviously the council have to provide those interventions and services. So that includes health visitor checks, the weighing and measuring of children at reception in year 6, and sexual health services and substance misuse services as well. On page 4, I have outlined some services and contracts which are aligned or interdependent with the current service. That includes the Family Hub programme and will need to be considered within the future delivery arrangements. So over the last 5.5 years, we've had regular performance monitoring meetings, and we know that the provider, when benchmarked against other areas, is delivering well against the requirements of the service specification, including those really key mandated services and provision. So as go through the report, on page 4, there's further information which outlines the new procurement legislation, the provider selection regime, which was introduced under the Health and Care Act in 2022, but as I say, went live in January this year. The council has greater flexibilities under the PSR when we're looking to procure healthcare services such as this service, such as the 019 service. There are 3 other procurement routes available to us, and what that means is we don't always have to follow a full competitive process when considering new services, and this is obviously important when we want to reduce bureaucracy and costs, when we know that services are doing well and doing a good job. So procurement and legal have carried out initial review and looking to apply a direct contract award to Bolton NHS Foundation Trust using the direct award process C, and the Process C may be used to award a new contract to an existing provider or to replace an existing contract that's coming to an end. So we follow the statutory guidance, and a number of tests need to be met, and we are confident through our reviews that these tests have been made, which includes the prerequisite that the contract isn't considerably changing, and we've carried out a robust assessment that the existing provider is delivering well against the current contract in terms of different criteria, which we can go into, and the provider is likely to deliver against future contracts and arrangements. So we've done that with legal, procurement, finance colleagues. We've drawn upon a wealth of information and looked at all these different aspects, which includes quality, innovation, value, integration, access and social value. So really strong review component to this. We're satisfied that the tests have been met legally, and we have assurances from the information we've reviewed that the service is likely to perform well going forward, and everything is in line with the statutory guidance following the PSR rules. So through this paper, we're recommending that PSR Direct Award C is appropriate for this contract, and the Foundation Trust are fit for purpose to continue to provide services from April 25 onwards. Pending approval of this award, of this contract award, we will then be required as a council to communicate our intentions to make a direct award publicly, and we will need to observe a standstill period of 8 working days, during which obviously representations can be made. If at any time the direct award is considered not appropriate or unfeasible, we can abandon the PSR process and revert to a competitive tender process. Timescales are outlined in the reports. So under section 4, it outlines the advisory points from our legal and finance teams, and that includes the lifetime value of the proposed contract going forward, and it also references the equality impact assessment, which can be accessed at the back of the document. And then just to go back to the essence of the recommendations, we are recommending that this meeting through the ECM approves a direct award to the current provider for the provision of the 019 services using PSR Direct Award C for a contract term initially of 3 years. So thank you, Chair.
Thank you, Suzanne. Thanks for taking us through the report. Very helpful to have it outlined. At this point, I'll ask if there are any comments, questions or observations from opposition members. No, Councillor Morgan, no. Nobody else indicating. All right, thank you. So with the reassurance that our legal department have provided on the safeness of using the legislation to do a direct award, I'm comfortable with the recommendations. We know that Bolton NHS Foundation Trust is a trusted partner and has been providing that good service in the past. So it is positive that we've been allowed to do this and not have to go out to competitive tender. One of my biggest frustrations in local government is that competitive tender process that we often have to follow, and it just means that things take a lot longer. And 9 times out of 10, I'd argue that you end up picking the organisation that you probably would have wanted to pick anyway, had you not had to go through that process. And particularly with this as an example, we know that in other parts of Greater Manchester, where local authorities are responsible for commissioning this service, it is normally the local NHS hospital trust that does that as well. So here we're not really deviating from what is expected. So without any comments or questions from opposition members, the recommendations set out on the front of the report to approve the award of the contract and delegate authority to the Director of Public Health to enter into suitable contractual arrangements, and authority to the Borough Solicitor to carry out all necessary legal formalities are approved. And that
Brilliant.
can be noted. All right.
Yeah. Thank you very much. Thank
Right.
you.
Thanks, everybody. And see you after the elections.
Yeah. Okay. Thanks for your
Right.
time. Thank you.
Take care.
Thanks, Sean. Thank
Bye.
you.
Bye.
Bye.
Thank you. Thank you.